You're all aware of the Regulation of Care Law 2014, the period of time that it's taken to get the requirements and the standards passed, the implementation of the law in 2019. This has been quite a busy year for the Jersey Care Commission. I've come in sort of towards the end of the year, and in some respects will take some of the glory and some of the credit for taking forward the fairly extensive programme of work that's been necessary in order to make sure that all of the services that are being provided on the island are appropriately registered. And we're almost entirely through that process at the minute, so it's been extremely helpful working with providers and their cooperation, etc., in relation to bringing the registrations forward, which will leave us basically starting off from the beginning of next year with everything on the register as appropriate, and then really being able to start to regulate in accordance with the regulations and standards in a full year. So we're quite looking forward to that. You will all know as well that this is the first time that both state providers and the independent sector providers are all required in exactly the same way to register with the Jersey Care Commission. So that's quite new to Jersey, and that's quite significant. And it basically means that if you're a care receiver in a states-run service or a service being run by a charity, you absolutely should expect the same level of quality in terms of your experience of that service. So that's very, very important. You'll be aware that care homes for both children and adults are expected to be on our register now, adult daycare settings and home care services for both children and adults. So they're the main groups that we're focusing on at this moment in time. And as I said, most of those are now successfully on the register and have completed the registration process. I mean, at the moment we have in and around about 100 services that are either in the process or still going forward for registration or have completed the registration process. So that's quite a lot. And going forward, there's a requirement in law that we will inspect every one of those services once a year. It doesn't say a maximum of once a year, but certainly the law dictates that we must inspect once a year. Hello, come on ahead. The law, however, is quite silent in terms of how we do our inspections, when we do them, what we look at when we inspect, and where we actually inspect. So there's a lot of freedom within our gift, if you like, to decide how we're going to inspect services, what we're going to look at when we're there, what standards we're going to focus on, how we're going to inspect, etc. And I suppose this is a very long-winded way of saying that we will absolutely rely on our partnership arrangements with yourselves and other groups to help us to work out what's the best fit for Jersey. So we have a lot of methodology that we could apply that works really well in other jurisdictions, and it may or may not work in Jersey. So I think there's a bit of work to be done in terms of taking that forward and looking at the new inspection year and how we're going to go about tackling it, if you like. For anyone that's read our sort of public-facing information in terms of our website, you'll see that we've made a very firm commitment to being person-centred. And I firmly believe that outcomes for people who use services should absolutely be our focus. So that's exactly where we should be pitching our efforts. We should be making sure that we have maximum impact in terms of driving up the outcomes for people who actually use services. We also have an obligation to make sure that we operate efficiently and effectively. So our resource is really quite small. If there's only a handful, if you like, of regulation officers, the team is growing but very, very slowly. So I need to make sure that I skill them up and target them in the right areas to make sure that we maximise every opportunity that we have to drive up improvements in services where necessary. It's also important that when we go out and we see good practice that we report on that and we celebrate it, and that we make sure that we publicise it and draw other people's attention to it, because that's a really good opportunity to drive up improvements as well. The Jersey Care Commission receives a lot of information about services and about matters that impact on people who use services. So again, that's another very good opportunity for us to take that into account when we're trying to regulate a service. What we're hoping to do is to make the very best of any opportunity that we have to engage with service providers, people who commission services, other statutory partners including police, safeguarding, social services, etc. We absolutely have a duty as a regulator to push out what we believe is the very best of practice, and that's something that we're committed to. At the moment we're developing an inspection policy, and we're developing a policy on escalation and enforcement, because we believe very strongly that if you're subject to an inspection as a provider, you really should be able to anticipate what that means for you as a provider. So what the inspection might look like, how often the regulator is going to inspect, the types of things they're going to look at on inspection. Again, if the regulator has a concern about your service, you should be able to anticipate with some degree of certainty what that might look like, what the regulator might do, what action they might take. And you're probably aware that in the law, that the law gives us a number of powers and duties that we can take should we find ourselves in a situation where there are concerns about the safety or well-being of people who use services. So we will be going into consultation on those two key policies. I mean, it's likely to be before Christmas. How much before, I'm not sure, because they are very much in draft form at the moment. So again, that would be an opportunity for everybody in the room to keep an eye out for those and to please give us your comments in relation to them. In terms of our future, I mean, we have our programme of work, as I've just described, in terms of those regulated activities. We are aware that the policy direction is to make sure that we have much more footfall in children's services. So currently we have the authority to go in and inspect every children's home on the island. Going forward, we'll be looking at children's social services and children's mental health services. So we expect within the next 12 months or so that our team will have to get itself ready to take on that very important piece of work. And shortly behind that, adult social services and adult mental health services will follow. So that will be another part of the scope of the Jersey Care Commission. And ultimately, the new hospital, hopefully, when it's built, will also be subject to the scrutiny of the Jersey Care Commission. And of course, at any time, the Chief Minister could ask us to do a particular piece of work on his behalf. And of course, we'd have to respond to that. So I suppose that's a bit of a summary of where we are at the minute, a summary of where we're hoping to go to. I suppose in the short term, for any service providers in the room, we have a couple of workshops that are coming up towards the end of November, which we'll be writing to you about in the next week or so to invite you to come along. The workshops are for providers and for people who have made an application to register as a provider. It will be an opportunity to help us to develop some of our tools and some of our methodology for next year's inspection year. We also have a communication strategy that's in draft form at the minute, and we think it's very important that we finalise that pretty soon, because we're very keen to make sure that our profile is raised, but raised for the right reasons, and that we're making the best use of any opportunity to engage with the very wide range of stakeholders that are involved with the Commission. That pretty much summarises where we are at the moment. I mean, Jim, I don't know if you wanted to have questions now or comments now, or...
No, I think we'll take questions now if you could.
Yeah, okay.
If I could add to what Audrey said, I mean...
what do they look like? How do they work? Because it's quite a variety of things that you're regulating.
Yeah. I mean, inspections to date typically are undertaken over one day. Typically they're unannounced, although not always. Typically it's one inspector will turn up in the morning time, introduce themselves, show their pass, and then make their way around the home and ask a series of questions, speak with people who use the services, speak with the relatives if they're there, spend time with the manager, spend time in the office looking at a range of records, etc. etc. I mean, that's typically how an inspection would run, and that's in a care home. If it's a home care service, typically the inspection will be a case of going to the office that is registered and undertaking your inspection there, where of course you're not going to meet anybody that actually receives the service, and chances are you're not going to meet anybody who delivers the service either. So the challenge for us is to make sure that we get under the skin of that sort of service and create and avail of every opportunity available to us to make sure that we're hearing the voice of the person who's actually using the service and the staff that are delivering it. So again, it is within our gift to be very creative, very innovative, to work with providers to make sure that they have opportunities as well, to draw to the attention of the relevant people that they're doing business with, essentially, the role of the regulator in terms of the go-to person, someone that you can come and tell the regulator about your good experience, or bring something to the regulator that is maybe concerning that you haven't been able to raise with the provider themselves. Does that answer your question?
Yeah, I'm just curious, because the other thing you mentioned right at the beginning was actually celebrating that good practice and the things that are going really well.
Yeah.
And it feels as if it's sort of regulation.
It does.
So they're punitive.
Yeah, it does.
But actually, how do you balance that with making sure that people know?
Absolutely. If you were to go out into King Street on any given day and do a poll, I'm sure the people that you met would be divided between the opinion that the regulator needs to go in and detect, and they need to go in unannounced, and they need to go, the element of surprise, and that's really how you'll get under the skin of a service. Other people may be of the view that, well, actually, if you're an improvement agent, surely you want to work alongside the provider, you want to work in partnership, so actually you might not want to go unannounced at all. You might want to tell them when you're going and give them every opportunity to have everything ready, and etc. So the regulator will always be, I suppose, walking a bit of a tightrope in terms of how they approach certain things. What I would be in favour of would be a blend of approaches. So in some cases it might be very appropriate to go completely unannounced in some cases. In other cases it would be very inappropriate. In fact, it could be very intrusive to a very, very small care home, for example, to just arrive in, to do your inspection with no regard for the fact that people who use the service might find that extremely distressing and disruptive, etc. So I think we have to take it on a case-by-case basis. And again, that's within our gift to do that. But we have given a commitment to being person-centred and to seeking assurances around good outcomes for people who use services. So I mean, we have to be part of that as well. So we have to be sensitive to the need.
Yes, appertaining to how do people know you exist? If they're in care, how do they know where and how to contact you? Obviously, a lot of people in care probably not too aware of what's going on around them.
Yeah.
How do they know?
I suspect they don't know. That's my strong suspicion. I don't have any other evidence to the contrary. We, as part of our communication strategy, absolutely need to take into account that not only people who currently use our services or use the services that we regulate, but people who are likely to use them at some point in the future, or their relatives who are maybe looking for a service for a relative might not know, might never have heard of the Jersey Care Commission, may know of them, but might not understand exactly what it is they do. So I absolutely have identified fairly early on that there is a gap there.
Is there any obligation under the law that everybody in care shall receive a letter or leaflet that there is this organisation?
Not that I'm aware of. I don't think so. I mean, when I was saying earlier about our inspections and the law being quite silent in terms of how we do our inspections, it is absolutely within our gift to put in place arrangements that would encourage and support and facilitate providers to leave our contact details, make us extremely visible during the inspection, but we're only there one day a year perhaps. So we have to think of other ways to make sure that people who use services are aware of who we are. That could be that we're leaving little comments. We're asking providers maybe to put up posters. I mean, there's a whole range of things that we could do. I mean, outside of inspections, there would be nothing to prevent us from going along to an evening where perhaps there's maybe a residents' meeting or a family meeting. I mean, we're looking at all of those things.
It could be staff, of course.
Pardon?
There could be staff who might want to contact you.
Oh, absolutely. Yeah, it isn't just care receivers. It could be staff, it could be relatives, it could be a whole range of people who might want to tell us something of significance about the service, which could relate to the very good experience that they've had, or it could relate to a concern or a complaint. Yeah. Yeah, I mean, the law states that you have to have an address in Jersey. It doesn't mean, that actually doesn't mean your limited company has to be based in Jersey. That's my interpretation of it, and that's been supported by our law offices. So an address has to be in Jersey, but the company itself doesn't have to be established or operating from Jersey. So yeah, we would have a number of situations where companies from outside the island or the provider organisation would have an address on the island, but actually they operate off island.
That's a cheeky question at this stage, but how many of those companies are currently providing care or are registered? Oh
goodness, I don't know it off the top of my head, but I could find out very easily for you. That wouldn't be a problem. I would just have to go and take a look at our register. So I'm afraid I wouldn't know that off the top of my head, but yeah, I can get information for you. Not a problem.
Sorry.
Where does the line stop for people being cared for in their own homes? Do you have any interest in that?
Being cared for in their own
in homes? Their own homes.
Oh, absolutely.
Yeah.
Yeah. I mean, if somebody's receiving personal care, personal support, social
even
care,
from a member of the family caring for them? No.
Not from a member of the family. So
right.
I suppose unique to Jersey, the regulation of individual carers is something that is now in law within Jersey. So
right.
if you're employed by an individual in the community to come into their home and provide them with the care and support that they require, you're required by law to come and register with the Jersey Care Commission.
Right.
Obviously there would be other agencies or organisations that also would provide those services, but in addition to those requiring to be registered, individuals who are providing that service are required to be registered with us. They aren't required to have any sort of inspection, the individual carers, but they are required to be registered. And at the point of registration, we can apply conditions to registration to ensure that they will keep themselves up to date with training, etc., etc. So home care the regulation of home care is quite new to the island. However, prior to the Jersey Care Commission coming into being, there was an approved provider scheme. So there was some oversight from the Department of Health in terms of the quality of those services. So it's not as if quality assurance is brand new to those services. It absolutely isn't. The individual carers regulation, that is new.